by connecting with our guest for the day, Dr. Puti Khairina, a general practitioner at the MMC Hospital. Good morning, Doc.
Morning, Doc.
Hi, hello, good morning.
Hi, thank you so much for joining us, Dr. Puti.
Thank you for having me today.
Before this talk show, I always thought that oral health just means brushing your teeth.
Yeah.
So since we have you here, could you please explain to us, what does oral health mean?
Okay, oral health is our mouth is our body front door, right? So people always mistaken that just taking care of your teeth and that's all. But they don't think that how oral health can affect to our overall health. So to protect our oral health and to protect our overall general health, besides brushing our teeth, we have to doing floss, okay? Because sometimes people forget to do floss. They just do brush, and actually I don't think not all people do brush twice daily. So please do brush your teeth twice daily and then do floss, because there are parts in your teeth that brush cannot reach. Also, don't forget to brush your tongue as well, because just don't leave the tongue, because it's really important. Bacteria can grow in your tongue as well.
All right. Now, Doc, touching on that, I've only learned recently, I guess in the past couple of years or so, that we should be brushing our tongues, because it's kind of a weird feeling.
I do that every day.
Right?
Yeah.
And my wife told me, she's like, are you brushing your tongue? And she's teaching our kids as well. And I noticed that if, let's say I had a morning coffee and then I went to brush my teeth and I brushed my tongue, there's all this like coffee residue that comes off. So things do get stuck on your tongue. But to go into perhaps a little bit more detail, why is it so important for us to brush our tongues, Doc?
Okay, it's very important to brush our tongue, because bacteria can grow on your tongue as well, not only in your teeth. Actually, bacteria can grow anywhere in your mouth. It can grow inside your cheek, it can grow in your teeth, it can grow in the gums, and also in tongue. So if you don't brush your tongue daily, just you do brush your teeth and do floss, it can grow bacteria there. And what happens if a bacteria grows in there? You can have bad breath. If you ever experience bad breath, that's probably you don't brush your tongue too when you brush your teeth. And then for any disease that it caused because of you don't brush your tongue is the growth of fungi. It's called candidiasis, oral candidiasis.
Oral candidiasis. What happens to a person when they experience that?
When people experience oral candidiasis, it can lead to another health. It can affect to our bloodstream as well. The bacteria, the fungi can go to our bloodstream and can cause another infections to our body. And most uncomfortable feelings that patients will experience is a very bad breath, and the tongue is white, coated white. And if you eat, you can probably not taste the food really well because of the white tongue.
That's possibly the worst thing that can happen for me. You're not able to taste my food.
Yeah.
All other things aside, of course.
No, but that's true though, because it's the most basic thing that we would love to have, right?
Sure.
To enjoy the food that we eat. So what other health conditions that can happen if we don't take care of our oral health, Doc?
Again, this is a very nice question, actually. Sometimes people don't know that how come oral health can affect to our general health, right? But actually, there are some studies. Some studies have shown that there is a connection or a relationship between oral health and your general health. The study has shown that it may increase the incidence of cerebrovascular disease, or we call it a stroke. It can cause heart problems. It's called endocarditis. It's like inflammation in the inner lining of your heart. And then also, if you are a pregnant woman, it can cause complications in pregnancy and also in diabetes as well. That's why sometimes I often got patients in visits to GP, because I'm a general practitioner, not a dentist. So I wonder why people still come to GP if they have a dental problem. And this is I want people to more aware of because why you have come to GP when you have problem in your mouth. It's better for you to go to your dentist
Yeah.
because dentists know better what to do with your oral problems. Dentists know better how to take care of your oral health. And when I ask them why they visit to GP instead of dentist, it's because they have dental anxiety. Do you
What is that?
Do you guys have dental anxiety?
What is
No,
that?
I'll attest to that. I used to have dental anxiety.
What is that?
I don't know if perhaps I had a bad experience when I was a child when I went to the dentist, or
Oh, is
you know,
that?
just this general stigma of dentist kids being scared to go to the dentist. So I actually neglected a lot of dental visits until I found the right dentist. So if anyone out there has dental anxiety, find yourself a dentist that you feel comfortable consulting with at first. Talk to them first, and then get a good rapport. And that way you can trust them with an open mouth and let them do anything you want. Like that's what did it for me. And now I love going to the dentist. By the way.
So is that what is called
That's what it was
dental
for me.
anxiety, Doc?
Yes, it's feeling afraid or anxious every time you come to the dentist because, well, dentists might be scary with all of the machines, all the brush and the sounds of the
Equipment.
machines, right?
Yeah.
And of course, children sometimes were afraid with that. But I heard that, well, go to the dentist since you're a kid.
Yes.
Actually, that's nice because that's what parents can do to make the people less afraid to go to dentist is to take them as early as possible to a dentist.
Yes.
So it's better for kids to go to a dentist before they reach 1 year old, and then go to dentist regularly like adults do every 6 months.
Mm-hmm.
Just go to dentist before you have any symptoms, because sometimes you have oral problems without any symptoms yet.
And that's the thing too. I think checkups are important because if you only go see a doctor, or if you do only you don't do general checkups, you only go to a doctor when you're sick, or you go to a dentist when you have a toothache.
That's
well, then
true.
you're only going to experience the bad parts because dental visits are fun. I love my doctor. Hi, Dr. Albert, in case you're watching.
I need to do that. That is note to myself, actually, because the last time I went to a dentist was pre-pandemic. So thank you for the reminder. So when they go to you, what do you explain to them? I mean, it's like, especially regarding the effects of not taking care of the oral hygiene and the effects on their body.
When the patients go to GP, you mean?
Yes, that's correct.
Okay, when the patients go to me, I actually refer them to dentist directly because I cannot see the oral clearly without the tools that dentists have. Because in our place, the GP, we don't have that tools that dentists have. So I can only see with my pen light and see, okay, if there's any tooth decay or gums problem. But to know better, to the place that what my eyes can reach, it's better to go to a dentist. But if they are in pain, like in emergency, we cannot refuse patients in emergency, right? If they are in pain, I just give some painkillers first, then I refer them to a dentist.
Okay.
Is it true, Doc, that actually it goes the other way around as well? I mean, if we don't have good oral hygiene or oral health, that will impact the rest of our body. But also, I remember, if there is something wrong with our stomach or our bowels, that's going to also impact our oral health, because suddenly we have ulcers, mouth ulcers, and everything. Could you please confirm that, Doc?
Yes, that's true. Actually, because that's what I said before, that mouth is our body front door, right? So everything goes inside our mouth, like foods, we drink water, we speak, and the air comes to our mouth. So if we have problems with our bowels, it's like, for example, we have diarrhea or vomitus because we mistakenly eat something is not healthy, probably. It produces acid, right, in your body. And sometimes when you go vomit, the acid go up. It's like reflux to your mouth.
Reflux, right.
And the acid, well, it's acidic, right? It's acidic, and it can cause harm for your mouth. So that's why it can cause a bad breath, and then ulcers, and feeling not comfortable in your mouth. So, yeah, there's a connection between our oral and our general health.
Doc, you mentioned that bad breath is actually a sign of poor health and an indicator of poor health, whether it's directly from your oral health or from within your body. a lot of people try to alleviate that instead of actually taking care of themselves. They'll just have mouthwash. They'll just
Or
throw
mouth spray.
or mouth, yeah, or a stick of gum. But actually, mouthwash there's a lot of myths. Some are pro mouthwash, some are actually against it. What's your take on this, Doc? Because we've heard rumors that it may not be good for you, but we've also heard others say, well, if you use mouthwash with disinfectant, it actually helps kill all the bacteria and germs. So what's the actual real take on mouthwash?
Okay, so mouthwash is actually not necessary for our oral health in daily. It's not a substitute for brushing and flossing. Okay, it's not a substitute. It's just like an additional. Some dentists would say that mouthwash is not recommended to use in daily because some mouthwash is acidic or contains alcohol that can make your mouth dry. And also, if it's too acidic, it will kill all the bacteria in your mouth, including your normal bacteria. We need normal bacteria in our mouth to
good bacteria
immune system. Yes, if we use it too much, it could kill normal bacteria. And bacteria-free environmental is very unpleasant because it can grow more bad bacteria there. So mouthwash, as far as I know and as far as I've read, is to recommend use mouthwash every twice a week is enough actually. But some people might I'm feeling fine using mouthwash every day because I have a fresh breath. Well, it's okay to use that. But if you experience dry mouth and pain in some areas, just not using it daily.
Okay, so
I
use it.
actually have never used mouthwash.
Yeah, no, I figure,
I'm
maybe
not so big on it.
perhaps pre-pandemic, if you had a big event and you just wanted to be fresh right beforehand, then you would generally use a little bit of mouthwash. It's not something you're supposed to use regularly. That's what I've heard too as well. Just don't rely on it because some people are like, oh, I didn't brush my teeth today. At the office, they'll just use some mouthwash. Well, some people forget to brush their teeth.
No!
No, I'm serious.
Oh my
Don't do that
I've had friends like, right, Doc? I mean, there are people like that. Like, oops, I forgot. Sorry, I'm just throwing out mouthwash.
Wow, that is actually amazing. But you know what? What I can be proud of myself is that I scrape my tongue every day, every time I brush my teeth.
So you don't use the toothbrush. You use an actual tongue scraper.
Yes.
Which is that better? Like, because I don't have a tongue scraper. I only use my toothbrush, Doc.
It's okay. The scrubber, okay. You can use toothbrushes, okay. Anything, but just do it slowly. Do not do it too harmfully.
Yeah, it feels weird, so I
make your
still.
tongue bleed.
Yeah, because of the gag reflex. You know, if it's
that's what
toothbrush,
it is.
it's the gag reflex.
If you
that
go
I
too
know
far to your
Right.
it will cause the gag.
Yeah.
There you
Okay.
go. Well, Dr. Puti, do you have anything else that you would like to say? Maybe a message, especially considering that we are celebrating the World Oral Day tomorrow. Maybe about oral health or about health in general. Go on, Dr. Puti.
Okay, so in celebrating World Oral Health Day, I want people to be more aware about their oral health. I want people to protect their oral health in order to protect the overall general health. And just go to dentists, okay? Don't have dental anxiety. It's very important. The least people can do. If you have privilege to go to dentists, please just go to dentists because there are some people that doesn't have privilege to go to dentist because they're in a rural area or there's no dentist there. You have a privilege to go to dentist. Just go there before you have any symptoms.
Great point. Well said, Dr. Puti. Thank you so much, Doc, for your time. You are a wonderful person. No wonder people don't have anxiety when they come see you. Anyway, stay healthy. Take good care.
Bye, Dr. Puti.
Happy
World
Take care.
All right.